Hi everyone, welcome back to my channel, Doc at Home, where I try and demystify original peer-reviewed published scientific research on selected topics for the benefit and awareness and education of those that are interested. If you have any topics you'd like me to research, drop me a comment and I will see what I can do. To the new viewers out there joining us today, check out my other content on my channel, and if it's for you, please like, share and subscribe. Today I'm summarizing a published follow-up part 2 study on circadian blood pressure rhythm in normal as well as diabetic mice during different feeding states. So let's start. Howe et al. Did a follow-on study to the 2021 paper which I talked about recently. A link to that video is on the screen. If you haven't watched it, I suggest you watch it before viewing this talk. It will make more sense if you do it in this order, but if not, don't worry, you can always watch it afterwards. The 2022 paper is called The Role of Sympathetic Pathway in Light Phase Time-Restricted Feeding-Induced Blood Pressure Circadian Rhythm Alteration. Full text available from Frontiers in Nutrition. Some key concepts discussed in this paper includes time-restricted feeding, blood pressure circadian rhythm, microRNA expression, type 2 diabetes, sympathetic nervous system, epinephrine, norepinephrine, to name a few. You're probably asking, what does this have to do with me, and how does this affect my life or that of my loved ones, now or in the future? Let me break it down. Mouse models, including diabetic ones, are used in research because of their genetic, biological, and behavioral characteristics that are similar to that of humans. In the case of diabetes, these models allow researchers to study disease mechanisms like blood sugar regulation, insulin resistance, and how conditions as such disrupts the circadian rhythms and affect and influence cardiovascular risk. While not 100% identical to humans, these mouse models are essential for understanding complex diseases in a controlled environment before moving on to clinical human studies. And the insights gained in mice often help form hypotheses that guide human research and clinical trials. So let's imagine it's late evening and you're grabbing a meal or you're having an after supper snack, and that's before bedtime. While this may seem harmless, the research I'm talking about today suggests that eating late might be affecting more than just your sleep. It could be altering your body's natural blood pressure rhythm. This is particularly important for individuals with type 2 diabetes or those with underlying heart conditions. By disrupting the circadian regulation of blood pressure, constant late eating or snacking could increase cardiovascular risk, contributing to the onset or worsening of heart disease and type 1 and type 2 diabetes. Now that we have that out of the way, let's return to the peer review paper and see how the researchers came to their conclusions. Please stay with me on this. Just a quick recap. Blood pressure circadian rhythm is blood pressure naturally follows a 24-hour cycle, typically dipping during rest. Sympathetic nervous system controls fight or flight responses, increasing blood pressure during stress and or activity. Disruption of blood pressure rhythm, non-dipping blood pressure, i.e. the failure to lower blood pressure at night, is linked to higher cardiovascular risks. And the study focus is investigating how meal timing, specifically eating during the rest phase, which is the light phase for the mice, impacts blood pressure circadian rhythm via activation of the sympathetic nervous system. The problem. Many people with diabetes have non-dipping blood pressure, which puts them at a higher risk of heart disease and strokes. The current knowledge is that scientists know that what and how much we eat affects our health, but they are now also learning that when we eat is just as important. The previous knowledge, so in the 2021 paper, there was time-restricted feeding during the active phase, and it helps restore blood pressure rhythm in diabetic mice by suppressing sympathetic nervous activity. In this paper, we're exploring the effects of light phase time-restricted feeding, i.e. eating during the rest phase, and how that impacts blood pressure rhythms in both wild type, which is normal, as well as diabetic mice, and the role of the sympathetic nervous system in these changes. In terms of methodology, the subjects were 17-week-old wild type and 21-week-old diabetic mice. The feeding pattern was ad libitum feeding, ALF. Both wild type and diabetic mice were allowed to eat whenever they wanted for 3 days. This was then followed by light phase time-restricted feeding, where the mice, both sets of mice, were switched to a light phase TRF for 7 days, where food was available only for 10 hours during the light phase, and that was a time period slot from 2 till 12. The measurements were, there was continuous measurements of food intake, blood pressure, heart rate, and sympathetic nervous system activity, and that was recorded using telemetry and biodat systems. For those buffs interested in statistical analysis, the researchers expressed the data as mean with a standard error of the mean. They also used paired and unpaired t-test for comparisons within and between groups. They also did a two-way ANOVA for comparing multiple parameters with 2K's post-test. And then they did linear regression for correlations between food intake, blood pressure, and locomotive activity. And finally, they did ANCOVA, and that's adjusting for activity levels to compare feeding method and light conditions. In terms of results, if you look at figure 1, all these various graphs basically just show that food intake correlates with blood pressure rhythm in the ad libitum fed mice, and this is the mice that both the wild type and the diabetic mice in that first 3 days when they were just basically fed as and when, and they were not time restricted in their feeding. And in figure A, you can see how it actually goes up and down in terms of the feeding, and that was measured in grams per every 30 minutes, and the mean arterial pressure also measured in increments of 30 over the 3 days corresponds with the feeding. So it goes up and down at the same time. In graph C, you can see as it's plotted how the mean arterial pressure goes down, and during feeding it goes up and it goes down again and up and down and up. And in D, the linear regression shows a value of 0.75, and 0.75 shows a stronger correlation between the variables, mean arterial pressure and food intake. And just to put that in context, if you have a number that are closer to 1, say 0.8, 0.85 or anything above, that will depict a much stronger correlation, and 1 would be a perfect correlation. And anything below, I would say 0.7 would be a weaker correlation. So the higher the number is up to 1, the better. A bit more on the results. Figure 4, light phase time restricted feeding rapidly alters blood pressure rhythm. So remember, light phase time restricted feeding is when the mice are fed during their rest phase and not the active phase. And normally mice will feed during the active phase, which is at night, because they are nocturnal mammals. So they were fed during the light phase, and it was found that the blood pressure rhythm was rapidly altered during the light phase rest period, during time restricted feeding. And also the light phase time restricted feeding worsens the blood pressure rhythm and the blood glucose in diabetic mice during the study. So what do these results actually mean? Correlation between food intake and blood pressure. In wild-type mice, blood pressure levels followed food intake rhythm throughout 24 hours during the ad libitum feeding, the anytime you can eat feeding. Light phase, time-restricted feeding reverses blood pressure dipping. When food was only available during light phase, blood pressure dipping was reversed, leading to higher blood pressure during rest. Sympathetic nervous system activation and blood pressure changes. Light phase time-restricted feeding altered blood pressure rhythms by increasing sympathetic nervous system activity, indicated by higher urinary norepinephrine and epinephrine levels and changes in heart rate variability. Gene expression changes. Light phase time-restricted feeding increased the expression of SLC6A2, and that's related to norepinephrine transport, and also ADRA1D, and that's linked to alpha adrenergic receptor in mesenteric arteries, linking sympathetic overactivation to the blood pressure disruptions. Finally, the impact on diabetic mice. So in diabetic mice, light phase time-restricted feeding worsened blood pressure non-dipping and led to increased blood glucose levels. So to conclude, mealtime affects blood pressure. Eating during the wrong time, i.e. during your rest phase, disrupts blood pressure circadian rhythms by overactivating the sympathetic nervous system. The potential for human implications. Eating late at night may increase cardiovascular risk due to disrupted blood pressure rhythms, particularly in people with hypertension, type 2 diabetes, and cardiovascular risk. What are the future directions? It's clear that we need more studies to see if meal timing interventions could reduce cardiovascular risk in humans. For those interested in delving deeper into the nitty-gritty of this research, and believe me, there is a lot of data and information to peruse, I've included the article link in the video description as well as on the slide. Both are open access and available for anyone to peruse. Additionally, I'm including some useful videos on cardiovascular disease, what is a mouse model, why is it used in research, the link between diabetes and hypertension, all about circadian rhythm and hypertension management, as well as time-restricted feeding and what is intermittent fasting. So please note, as ever, this talk is not meant to be taken as medical advice or lifestyle advice, but solely for the purpose of education. Speak to your doctor or specialist and or your nutritionist if you have any questions or concern about your health and diet. If you have any specific questions on this talk, feel free to comment below. I'd love to hear your thoughts. If you like my content, please like, share, and subscribe. And I thank you for your time in tuning in. And until next time, bye for now.